Good afternoon, everyone, and welcome. Thank you for joining us for Leading Florida into a Brighter Future, Addressing an Unaffordable Economy. Today, we're having this conversation at a very specific moment in our state. In Tallahassee, lawmakers from both parties announced this week that they're rolling out their affordability priorities and openly acknowledging what families have been living for years, that it's expensive to live here, and the affordability crisis is getting worse. We're hearing a lot about property taxes, housing, insurance, and cost of living relief. But what we're not hearing enough are the voices of the families that are most affected by these decisions, especially with parents with young children who are trying to keep a roof over their heads, pay for childcare, put food on the table, and still give their kids the best possible start in life. Today is about bringing those voices and that data into the same frame. We'll be drawing on the 2025 National Latino Family Report and the Florida Spotlight feature, which captures what families with children ages 0 to 5 are saying they are facing in this economy and what they want from our leaders. First, you're going to hear a brief overview of the data to ground us in what families are telling us. And then today's guests, which include leaders from community-based organizations in Florida, will connect those findings to what they're seeing on the ground and talk about what solutions would actually make a difference. Before we get started, we do want to have a few housekeeping notes. Today's webinar is being recorded, and the recording, along with the links to the national report and the Florida fact sheet, will be shared with all registrants after the event. There's going to be time for Q&A toward the end of the session, but you don't need to wait. You can type your questions into the Q&A box at any time, at any point. When submitting a question, please include your name and organization. And if your question is for a specific guest, please let us know that as well. For members of the media, please include your outlet. Those questions will be prioritized, and we may invite you to come off mute to ask your question live. We're going to provide some instructions right now for those who would like to hear the session in Spanish.
Yes, good afternoon, everyone. We are going to be offering Spanish-English interpretation. We do encourage everyone to select a language unless you're bilingual. Otherwise, you won't be able to hear the interpretation from Spanish into the English channel. To access language access, you would have to, or the language channel, once the function is turned on, just scroll down or look at the bottom of your screen. You can click on the globe icon and then select interpretation and then English. Buenos días, buenas tardes. Gracias por unirse el día de hoy. Vamos a ofrecer esta sesión en español también. Para acceder al canal de español, por favor, en un momento, fíjense cuando se prende el canal de interpretación. Si están en su computadora, les va a salir el globo terráqueo. Allí hay que hacer clic y luego escoger interpretación y allí escoge español. Si está en su tableta o en un teléfono, entonces será un círculo con 3 puntitos. Igual allí hace clic, escoge interpretación y español. Gracias. Thank you.
Thank you, Amparo. The goal for this next hour is to connect 3 things: what families are telling us in the data, what organizations are seeing in their communities, and what the public is hearing in debates about affordability in Florida, so that those debates reflect the real experiences of families with young children. And with that, I want to turn it over to Javier Martinez, who will walk us through key findings from the 2025 National Latino Family Report, with a special focus on Florida findings. Go ahead, Javier.
Thank you, Sonia, and welcome everybody. And thank you for the reminder to slow down. I am the worst at keeping it slow, so I will be slow. First of all, thank you for the opportunity to be here, and thank you to our partners at UnidosUS, and as well as our partners who you will hear from a little bit later on this afternoon, who are on our panel. The Latino Infant Initiative was developed in collaboration with UnidosUS and Abriendo Puertas, Opening Doors, APOD. You all are very familiar with UnidosUS, the largest Latino civil rights organization in the country. APOD is an organization that works with families with young children with the core vision and mission that parents are the first and most important first teacher of a child. In that regard, we've developed this movement and this policy agenda connected to it over the last several years, based both on quantitative as well as qualitative data over the last several years. We will drop the link in the chat for the Latino Infant Initiative, latinoinfants.org, where you can find all of our research. You can find our policy findings and our policy proposals. These are policy proposals that span everything from the national level all the way to individual states and even local governments and municipalities. As part of the Latino Infant Initiative, every year we conduct a scientific poll of roughly 1,400 Latino parents and caregivers of young children, defined as ages 0 to 5. This poll that we will present today is the 2025 National Latino Family Poll Report. We will be conducting a new one in the early part of 2026. And we very much look forward to also sharing those findings with you at that time. This particular poll was conducted in 2025 at the end of January and early February, and it surveyed roughly 1,370 Latino families with young children. We oversampled 5 different states. Those states are the 5 priority states for the Latino Infant Initiative. And those states are California, Arizona, New Mexico, Texas, and of course, your home state of Florida, where we sampled 131 families. Florida is home to 6 million Latino residents, the 3rd largest Latino population in the country, and it is only growing. And it is not only growing, but it is growing rapidly. As we surveyed Latino families with young children in Florida, we talked about economic opportunity, we talked about healthcare, we talked about childcare, we talked about immigration and bilingualism. Now I'm going to give you some high-level data points here with regard to each of those areas to better ground our conversation this morning as you hear from our panelists later on. As you can imagine, and as Sonia expressed earlier, affordability is huge for families across this country, and the same is true for Latino families with young children. As in other states, Latino families in Florida are feeling the pressure of increased costs of living on everything from housing to groceries, etc. When asked to select the most important issues facing the Latino community in Florida, those surveyed focused on issues like wages, inflation, and affordable housing. As you look at the chart below, 38% of those surveyed identified improved wages and income as a top priority. 38% also identified the rising cost of living at the time and inflation. Now, keep in mind, this poll is happening at the very end of January and early February. This is right about the time that President Trump took office for a second time. Following closely to that 38%, 34% identified affordable housing as a top issue for Latino families. Of those surveyed, 67% stated that they are at the time looking for a better job or a promotion in their current job due to the rising cost of living. And 58% said that they would supporting programs that provide access to healthy foods, such as food pantries, food banks, the Women Infant, the WIC program, as well as SNAP, can help ensure that their family have access to nutritious food. When it comes to healthcare, health insurance coverage in Florida, unfortunately, is lower than in any of the other 4 oversample priority states of this survey. 20% of Latinos in Florida stated that they lack health insurance. That is compared to 13% of residents from other states and 19% of Latinos nationwide. Latino households are also more likely to rely on Medicaid for their health insurance at about 25%, as compared to the rest of those surveyed. As you can see from this chart below, from the infographic below, 98% of Latino families surveyed in Florida stated that lowering the cost of healthcare coverage is an important issue for them that they felt at the time the Congress and the president should be addressing in their first year. Now, to ground us a little bit, keep in mind, again, this survey was conducted in late January, early February. Fast forward 10, 11 months later, and the conversation, in fact, in the US Senate yesterday was very much about healthcare and the inability or perhaps unwillingness of the federal Congress to address the healthcare affordability issue. Moving on to childcare, we know that across the country, and this is true for all families, not just Latino families, childcare is a huge expense. And this is no different in Florida, and it is no different for Latino families in Florida. The average annual cost of childcare is more than $13,000 per year. This is significantly higher than the cost of in-state tuition at some of Florida's public universities. 59% of those surveyed in Florida report that their youngest child receives childcare. Of those, 46% say that they spend roughly between 11% and 25% of their income on childcare. And 23% say that they spend between 26% and 50% of their income in childcare. For those Florida families who stated that they have not received childcare, roughly half of those is due to the lack of affordable childcare options, as compared to 32% nationally. 34% of families in Florida reported having to reduce their work hours due to the lack of affordable childcare, as compared to 24% at a national level, while roughly 30% reported financial stressors due to increased childcare cost. I'm going to move on to the last couple of points here. Bilingualism, whether we agree with it or not, there's been a movement nationally to, do things like make English the official language or whatnot. I can tell you, I am based in New Mexico, and it is in our state constitution from when we were first founded as a state in 1912 that we have two official languages in New Mexico, English and Spanish. I state that because I think that what we've heard this year around English only, which reflects a little bit on the late 90s movement for English only, in many ways, in some of our communities, like in New Mexico, is complete nonsense. Now, not to editorialize, but these are important data points here that we're about to share. When it comes to bilingualism, roughly 22% of Florida residents live primarily in households that speak Spanish. Latino families in Florida strongly support bilingual and multicultural learning opportunities for their children, with 94% reporting that multilingual and multicultural education is an important factor as they're selecting childcare. 94%. 93% stated that they want their children to grow up bilingual in English and in Spanish. That's higher than the national survey result of 88%. 48% reported that their children are currently enrolled in bilingual learning programs. For parents with children who are not attending a bilingual school or an early learning program, 55% of them said that their child is learning English and Spanish at home, while 17% said that their children are already bilingual. Lastly, when it comes to immigration, which I would argue has actually been the focus of this administration over its first 11 months in office, 85% of respondents at the time of the survey rated border enforcement as important, with roughly half rating it as very important. 63% of those surveyed in Florida believe that their state should cooperate with the president's deportation plans only when it involves deporting those immigrants who are convicted of crimes, while another 27% said that Florida officials should not cooperate at all with the president's deportation plans. Again, the survey was taken at the end of January, early February. This is when some of these immigration plans were being discussed without a whole lot of detail, and of course, without them being implemented yet. As we follow up this survey, in the first part of 2026, we will also hone in on immigration as an issue. And I will be very, very excited to come back to your state of Florida to present next year's data, because my hunch is that given what we've seen over the last 11 months, these numbers will be quite different in terms of how Latino families in Florida think and feel about immigration. With that, I'm going to kick it back to Sonia. Thank you for the opportunity, and I'm looking forward to hearing from the rest of the panel.
Thank you. Now to introduce our panel, we have Jared Nordland, our Florida Policy Director for UnidosUS.
Good afternoon, everybody. My name is Jared Nordland, and I'm the Florida State Director for UnidosUS, based in Orlando, Florida. And before we jump into the questions, I'd like to give each of our panelists the opportunity to introduce themselves and share how their programs are helping moving our state forward. And with that, I will start with Isabel with RCMA. Please go ahead and introduce yourself, Isabel, and tell us a little more about RCMA.
Thank you, Jared. Good afternoon, everyone. I am Isabel Garcia, the Executive Director for RCMA. RCMA is a large nonprofit childcare provider in the state of Florida. We serve about 4,000 to 5,000 children daily in 20 counties, and we are primarily located in rural communities, serving predominantly farm working families, Latino families from 0 to 5 years old, and we also do charter schools where we have K through 8th grade. And our programs in the charter schools are bilingual, biliteracy education. And we employ about 1,600 employees as well. And we did celebrate in October 60 years of existence in the state of Florida, providing high quality childcare.
Thank you, Isabel. Next, Karina with Amigos for Kids.
Hi, good afternoon, everyone. I'm the president and CEO of Amigos for Kids. We're a nonprofit organization based in Miami. We've been around for 34 years. Our mission is the prevention of child abuse and neglect. And we move that mission forward on a daily basis through a variety of programs. We have a portfolio of programs and direct services that we provide primarily to Latino families in our community. That includes after-school enrichment program for young children, parent education programs, and wraparound supports for families in crisis. Thank you.
Thank you, Karina. Michaela with the Children's Movement of Florida.
Yeah, thank you, Jared. So, Michaela Buchanan, I am the Chief of Staff at the Children's Movement of Florida, and we have been around for 15 years. We are a nonprofit, nonpartisan movement of Floridians who advocate for the policies and investments that help every children thrive in the first 5 years here in the state of Florida. And we do that by amplifying the voices of parents and educators, engaging elected officials, and highlighting the role of business leaders.
Awesome. Thank you guys so much. I'd like to take what Javier shared about Florida and connect it directly to the work you guys are doing on the ground here every day. And as this is a quick reminder before we jump into the questions, if you do have a question, please write it in the Q&A box and we'll make sure it gets answered. So the first question is for Michaela. When you look at the things you're seeing in Florida on wages, the cost of living, and childcare, what stands out most to you in terms of how the state's current policy are or are not meeting the needs of our families?
Yeah, it's a great question, Jared. Thank you. So I'd like to start with some data. So you got some of the survey results there, but I think it's really important for additional context too, right? So in a state like Florida, we have been tracking for a number of years the percentage of households with children under the age of 6 who have all available caregivers in the workforce. That's 70%. So that means that everybody is at work and those young children need to be taken care of. And so for that reason, childcare is not optional for those families. We would talk about childcare as, the infrastructure behind our economy, really. And yet these families, as the survey showed, often pay significant percentage of their household income on care, on quality care. And that can be 11% for many families. It's, 13 just for one child. I know the average was quoted at $13,000 on average for one child. We know in Palm Beach County, that's over $17,000 for one child. In Suwannee County, which is sort of a more rural community, it's over $8,500 median. So you have one child, two kids, you're now looking at 40% of your household income just on childcare. And so many people, in fact, start to make some tough decisions at that point. Is it really worth going to work every single day? And one of our great partners at the Florida Chamber Foundation did a report, and they actually found that the answer for many families was no. Childcare issues are actually the number one reason that parents in Florida with children under 6 quit their job. And those are really a significant number of people. It's about 150,000 people every 6 months in Florida who are quitting their jobs because of childcare, going back home to take care of their children. And even if they don't quit their job, significant numbers of unplanned absences at work are also due to childcare issues. So you're talking like 55% of unplanned absences. So I think this shows up in a real way for many families and for many children, because whenever they drop out of care, or they have to limit their work hours, this is bad for the child, for their development, right? And it's also bad for our workforce and our economy. And so as a state, right, how have we tried to address this? We are very excited because last year we did have a huge win. I don't know that it got all of the press it truly deserved, but it was a big deal. We have in our state a program called School Readiness. And School Readiness is essentially the state's child care tuition assistance program for families who are in the workforce or who are continuing education. And it has an income eligibility threshold. And until last legislative session, that eligibility threshold was set at just 150% of federal poverty level. And so what that meant for Florida families was not only did you have to be in the workforce, but you had to be earning less as a family of 4 than $46,800 a year for 2 adults, 2 children, or 1 adult, 3 children. And that's not a lot of money, especially when we just talked about how expensive childcare is per child. And so again, this didn't really work for many families. So last session, we were excited because the eligibility threshold got set to state median income instead of federal poverty level. So it will continue to grow as Florida's minimum wage laws that we know we have increase wages across the state. So whereas federal poverty level was kind of meaningless for our economy. So we reset those eligibility thresholds to 55% of state median income. And that's a little bit more like $54,000 a year for a family of 4, which is not entirely that much better, right? But it is a step in the right direction and some opportunity to grow from there.
Great, thank you, Michaela. Next, Isabel. What are you hearing from parents and young children about the trade-offs they're making because of the high cost of childcare, the overall affordability, and then also just how is your organization responding to this crisis?
Yes, thank you, Jared. And I think following up on what Michaela mentioned, a lot of what we're hearing, first of all, 0 to 3, you find less childcare providers offering that because that is already talking about an infant who is 0 to 3 years old, which is more, the cost for that childcare is higher. And so many childcare providers choose not to serve this age group because the ratios are lower and the costs are higher. And so it's even just difficult for families to find infant care. So they choose to only find childcare for preschoolers 3 to 5. So that's the first barrier that there's very limited childcare providers choosing to do infant childcare because it's more costly for them. And when families are faced with this, like Michaela said, parents are making choices. Moms leave the work industry to stay home because they cannot afford, and they wait until the child is 3 years old to be able to get the lower rate or more cost effective. Then they go back into the work environment. In our CMA, we actually are providing services through Head Start, Migrant Head Start, Early Head Start, and school readiness. And so a lot of those criteria and eligibility provide childcare at no cost to the families, or like the school readiness at a sliding fee scale that is more affordable. So those are the kinds of things that we are all trying to look for, is how do you make programs affordable for families, and how do you partner with community agencies to provide scholarships to try to help offset those high costs to families. But the trade-offs are usually the mom ends up not going to work until the child is old enough to be 3 years old and be able to afford it.
Thank you, thank you. And just one quick follow-up, because Javier mentioned bilingualism during his presentation. What barriers prevent families from accessing bilingual early education? And do you guys know of any strategies that have proven to be effective in trying to fill that gap?
I think, as the data showed, if you notice, there's a lot of Latinos, and there's a big number in the state of Florida. And in the childcare industry, I have to say that a lot of our staff and teachers are all bilingual. So I think it's very accessible to a lot of the families. We do hire. I think you would find in the childcare worker industry that a lot of the workforce is Latino. I think you'll see more of a less of bilingualism when you get into kindergarten and up. So we're fortunate that our schools, our charter schools, and many charter schools, a lot in Miami-Dade County, are doing bilingual in their classrooms, in their curriculum. But I think you're going to find it more in nonprofit organizations and charter schools that are really catering to that population.
Thank you, thank you. Karina, what are you guys seeing in terms of increased need for food assistance amongst families that you serve? And just what does that tell us about the broader economic pressures that Florida families are facing?
Yeah, we are seeing what we're seeing at Amigos is absolutely mirroring what the National Latino Family Report is telling us. In fact, in a small survey of our own families, the majority of our families reported worrying about running out of food, food not lasting all month, and many told us that they've skipped meals so that their kids can eat. So the way we look at it is that it's not just about using food assistance. What this is actually telling us is, one, obviously wages are not keeping up with the significant increases that we're seeing in grocery prices. And also that families are making impossible trade-offs between rent, childcare, gas, and groceries. And also that food assistance has become a permanent part of the family budget. It's not just something that they seek out as an emergency tool. So for us, we're seeing food as a barometer, or food insecurity rather, as a barometer of economic stress. When families that are already working multiple jobs, they still need food pantries, then just to make it through the month, to us, it's a clear sign that the broader economic system is failing them, not the other way around.
Just a quick follow-up with that, how you mentioned it. Are you seeing families with young children needing more mental health or parental support? Is having to deal with the cost of rising costs and instability? And how is this Amigos for Kids kind of adapting to meet that demand?
Yeah, we see families with babies and toddlers are carrying the heaviest emotional load right now. When you layer the financial stressors on top of sleepless nights with a newborn or a toddler, difficulty in paying for finding childcare, the stress is compounded. And what we're seeing is that parents of children 0 to 3 are asking for help managing stress, anxiety, and depression. They're asking for concrete strategies for soothing babies and toddlers. And since our mission is child abuse prevention, we teach, managing those behaviors without resorting to harsh discipline. And We're adapting in a few key ways. One of them is that we recently started a program called Amigos Cradle, in which we use the period of purple crying. It's a evidence-based curriculum that helps caregivers understand normal infant crying and reducing the risk of shaken baby syndrome. We are doubling down on our evidence-based parent education and support, offering also small group sessions and one-on-one sessions to support parents on developing bonding with their children, routines, and discipline. And then we are providing wraparound supports and what we like to call intrusive case management for families that are facing serious challenges. When we see red flags, we're doing warmer handoffs for postpartum symptoms, intense anxiety, or trauma. And we connect parents to trusted behavioral health partners instead of just handing them a list. We also provide practical supports for families in these situations with basic needs like food, housing, transportation. Because, we do a great job of talking about self-care and the importance of self-care, but it's really difficult to talk to a parent about self-care when that parent isn't sure what they're putting on the table for dinner tonight. So we're treating mental health and parenting support not as a nice to do or an add-on, but really as a core child abuse prevention strategy in the context of the economic crisis.
Thank you. That's really, really good. Michaela, next question for you. We just finished up the last committee week for the 2026 session. And just kind of looking forward to January and everything that's going to go on with that. What policy solutions do you think would make the biggest difference in lowering the cost of childcare, expanding access to Florida families that they should be addressing in next session?
Yeah, so I started to allude to it earlier, and the first and foremost thing would be to continue to invest and expand on school readiness successes in the last couple of years. We know right now just about 211,000 children benefit from the state's tuition assistance program, and there are about that many babies born, I think, every single year in our state. And so we're certainly not serving a significant number of our families, even though it's a really important program and it helps so many already, but we need to continue to build on that. Something that we are trying to advocate for this session with a number of our partners across the state is really above and beyond school readiness, because the majority of that funding actually comes from the federal government through Florida to the state's early learning coalitions to offset the cost of care for families. So what would it look like if Florida actually had a dedicated funding source above and beyond school readiness, perhaps in the form of an endowment fund where public, private, and philanthropic resources could help expand access in a way that school readiness cannot do alone and has not been able to do alone. So we think that's something that ought to be looked at and sort of more innovative and a funding stream. A number of states around the country have started with endowment funds, and we're trying to learn from that and see what Florida can do next. And then another equally important, I think, legislative priority for us that we've had on the radar for a couple of years is actually in relation to our family childcare homes in the state. So removing some of the zoning exclusions and insurance barriers that they face as small business owners, so that, again, a family who is looking for that parental choice, they might want that smaller environment, more rural communities, can actually get access to it because the family childcare home is able to exist and from the beginning, right? It actually can start. And so more options, more seats, that I believe Isabel was referring to earlier, because we know that's a really big problem for many.
Thank you. Thank you. Isabel, you guys have been around for 60 years now, so clearly you guys are doing right. You guys are known for investing in your educators, as you mentioned. We know that many of them that you're investing in and working with come from the community that they serve. Just from your perspective, what does it take to build and retain a high quality early learning child workforce in Florida, in rural and agricultural communities?
Yes, thank you, Jared. As you mentioned, that has been a philosophy that started with our founder, hiring from the communities we serve. You will find in our CMA employees that have been with us for 30 plus years. And what has made it successful was as well that many of them live that lifestyle of the families being farm workers like myself, a former farm worker, a first college graduate. And when you know firsthand what these families are living, you are more sensitive, you are more caring and understanding with the families. And so in our CMA, we have continued to support and live by that philosophy, hire by that philosophy. But we've also had to keep up with new statutes and laws that keep coming down, requiring more training, certifications. And so a lot of our funding and grant writing is to support professional development opportunities to keep our staff ahead of, meeting those deadlines, helping them attain certifications like their Child Development Associate credential, working towards an associate's degree, as well as many who have earned a bachelor's degree in early childhood. And we have to invest in that. And many times there's trade-offs between where you make cuts because we have received flat funding. There has been very little increase to childcare. And I know it's difficult for many providers to keep up with the request or the increased requirements for professional development. But there's usually always funding that comes with that. Even with the school readiness funding, they're offering more incentives as quality improvement dollars, which then I find that childcare providers and organizations such as RCMA, you will invest those dollars to try to get the training that these caregivers need to be known as professionals. So it's really finding a way to invest those dollars back into the staff and helping them stay abreast of the current trends and providing an environment when they feel like they are valued and that they are teachers, they're not babysitters, they are educating tomorrow's leaders. And so it's really making them, giving them, and then trying to stay competitive with wages. As Michaela said, we're statewide. What the cost of living is in Palm Beach and Miami-Dade to what Ruskin and Waimama, there's a big disparity. And so we have to keep up with those trends and also try to be competitive with Amazon, Walmart distribution centers, because the base pay is like the same. So they'd rather go make boxes than care for a child. And so you have to take those things into consideration. And it's really making them feel valuable that you're a teacher that will help them stay here and make the choice like, yeah, I want to make a difference by helping nurture brains and children for the future, for our future, versus making the box. But you have to invest in that. And I think that that's where we always have to continue to advocate for increased funding, not just for the affordability for families, but for providers to hire and keep talented staff that have invested a lot of their life in the work that we do.
Yeah, that's really great. That's really great, Isabel. Karina, how do economic pressures show up in family stress, especially families with very young children? And then what are warning signs that community stakeholders like us should be aware of so those stresses don't turn into a full-blown crisis for kids?
Yeah, so economic pressures or signals show up in families long before um, the family situation becomes a case, quote unquote, in any system or even in our own system of care at Amigos for Kids. And it basically, we know that for parents of very young children, that family stress happens when you have families working multiple jobs or odd jobs, leaving babies and toddlers with a rotating cast of caregivers from friends and families, older siblings, constantly worrying about rent, food, and childcare. And, those kinds of stressors make parents irritable, exhausted, sometimes, engage in more reactive discipline and harsher discipline. And in that context, as we saw in the National Latino Family Report, that almost half of Latino parents say that their financial situation has worsened. When you take all that together, then, one can understand how stress isn't a character flaw. It's a predictable response to that chronic economic pressure and that strain. And so some of the things that we see with parents are parents that frequently express that they're feeling overwhelmed, or when parents say, I'm at the end of my rope, or I can't do this
Mhm.
anymore. Those are red flags. Caregivers missing medical appointments, or even families that, we work with, when kids miss, their youth development program, or they're absent, or when parents miss some of the parent education programs, we worry because usually that's a sign that something is going on. In our youth programming, we see that family stress showing up as, in the little ones as behavior changes, um, extreme clinginess or sleep issues, or, some aggressive behaviors. And one of the things that we've seen quite a bit at Amigos for Kids is families moving frequently. And that always scares
Mm.
us because we know housing is an issue. It's hard for us to keep up with them when they're moving so frequently. And we've seen a lot of families doubling up in crowded housing. Some of our families come to us already when their financial situation is dire, with, facing eviction, or utilities being shut off. Um, and the key, I think, to treat these situations as signals, not as failures. So
Mm.
when we come in contact with families and we see some of these things, I think that the best thing that we can do is just to say, what do you need, or how can we help? Because our job, I feel, is to normalize asking for help, and
Mhm.
making sure that, or our job at Amigos is making sure that we ask what you need, but that we have real supports on the other side of that question, and that we can intervene long before economic stress turns into a crisis for children. So, for example, with our Amigos Care program, one of the things we do is that when families come to us, and they're facing the threat of eviction, we know how traumatic it is for a family to be evicted with young children. But even worse is the fact that once a family is evicted, that finding them affordable housing is practically impossible here in Miami. So for
Mhm.
us, we know that it's a cost-effective way of stabilizing a family in crisis if the family has the ability to continue making rent payments after we catch them up and we prevent that
Yeah.
eviction and keep that family housed. So again, asking, what do you need? How can we help you? And making sure that we have real solutions and real supports on the other side of that question.
That's really great, Karina. Next, I'm gonna pivot over to Michaela one more time. Michaela, Isabel just told us and showed us that we know none of this work gets done without having a strong early learning workforce. What
Mhm.
steps must Florida take to strengthen and professionalize the early learning workforce so that educators can actually afford to stay in the field?
Yeah, when Isabella was mentioning that Florida needs to have competitive wages, and hearing Karina talk about families facing evictions and a lot of financial stress, what we should all remember is that these are actually our early childhood educators as well. In our
Mhm.
state, so many of our early childhood educators make less on average, they say, than dog walkers in our state. A significant number of them actually rely on public assistance themselves. And so, what we have seen in some states, as it relates to how different states use their federal funding that I mentioned earlier, those are CCDF block grant dollars. And so, when they come into the state, some other states, not Florida yet, have chosen to prioritize early childhood educators for those funds in addition to the other priority populations. Because without teachers, right, if we think about what we've been talking about with families, if teachers don't have childcare, now they can't go to work, right? And they are, these early childhood educators. And then that closes classrooms for our other working families because we need that educator in front of the room to keep that classroom open. And so that's one opportunity I think that we can look at as a state is what does it look like to prioritize early childhood educators with our school readiness program and giving them tuition assistance themselves if they have young children, as many of them do. We've also seen states open up their retirement benefits. And so this is a little bit of a something that I think is not talked about very much, but when you think about not only most of these educators, like other educators in the K-12 space, they're not doing this because they wanted to be a millionaire. They did it because they love children and they want to work with children. But it also still doesn't mean that they shouldn't have other benefits outside of pay. And so, like Florida's retirement system, what might it look like for early childhood educators to actually be able to take advantage of a retirement system like that? We've seen states like Arkansas open up their programs. And so perhaps that's something that can be looked at as well. But currently, one of the most effective tools we've actually seen in Florida that is working and we know is working really well is access to the Teach Scholarship programs. And so through the Children's Forum in the state, our legislature has appropriated $10 million, I believe, to the Teach program in the last year. And that's a program that enables early childhood educators to go back to school to earn those credentials that they need to get the bachelor degree in early childhood education and ultimately stay in the workforce. There's a sort of a requirement around that. But what we know is even outside of the work requirement for taking advantage of those Teach scholarship dollars, that they do stay above and beyond the national averages. And so we're seeing less than 10% of early childhood educators actually leave the field after they participate in the Teach program. So continuing to support Teach and recruit and retain early childhood educators, I think, is a great place for Florida to continue to invest and prioritize.
Thank you. Thank you. That's really good. Now I want to shift over just to Q&A. If there are any people in the audience that want to ask a question, please feel free to put it in the Q&A box. We'll give people a minute and then we'll see what we get for questions and then we can go from there. While we're waiting for questions, Isabel, Karina, or Michaela, is there anything else you want to share that you might have forgotten to share during our little chat?
No, not from me. Thank you, Jared.
Not from me either.
Okay, good. Well, it's thorough. Good, good. So it looks the chat is quiet. So I think we were pretty thorough with our presentation today and our discussion. So with that, what I'll just do is I'll close things up. Thank you again, Isabel, Karina, Michaela, for sharing your insights and your leadership when you guys do every day in our community. So thank you for being a part of this. For AP, OD, and Javier, thank you for your continued partnership with us and Unidos. Florida families are demonstrating what it takes to move our state forward, and our collective work ensures that their voices are shaping a brighter future, a more fair future for Florida. And we invite those who attended today to read our full 2025 National Latino Family Report. And also check out the Latino Infant Initiative as well website, where we'll find the state-focused reports and also stay connected with AP, OD, and UnidosUS for future dialogues like this. Javier mentioned that early next year there'll be a new round of polling being done, and so I expect that we'll be doing the same type of presentations again soon. Other than that, I'd like to thank everybody for attending today. And again, Michaela, Isabel, Karina, Javier, thank you guys for speaking today, and we'll see you guys soon.
Thank you for the opportunity.
Thank
Thank you
you.
for the
Thank you.
opportunity.